Yeah, so dementia is very different than most other conditions that we think of. We think about, diabetes or COPD or congestive heart failure. If you're in value-based care, meaning you could be a physician in an account care organization, or you might even be a physician employed in a health plan, your approach is to deploy care management teams. So the goal of care management resources is to engage the member or the patient in improving self-care. You might talk to them, you might coach them, you might provide them with materials. And it's proven that effective care management can actually bend the cost curve and get better outcomes. So why does this not work for dementia? Well, somebody with dementia can't remember their care plan. If you talk to them today, they might not remember that they talked to you yesterday. They can't articulate their symptoms. So this is a population that's largely not engageable in traditional care management programs. So if it was not a very expensive condition, you'd sort of say, well, it's okay, right? It's not a big deal. It doesn't cost much money. I can live with the fact that I can't engage people with dementia. But it turns out that when you look at Medicare claims data, dementia is the second most expensive condition in Medicare. Most people, Stacy, don't know this.
Yeah, I bet. Is there a dollar amount associated with it, from your research?
Yeah, so the average cost of somebody with dementia is $30,000 a year. Right? The average Medicare patient costs, $12,000 a year. So there's a huge difference. It's kind of hidden in claims data. So on our team, we have a chief medical officer who ran a health plan and tons of experience. One of our other board members is somebody who ran a national health plan, the whole thing. He said dementia was never a priority. Now they will tell you, oh yeah, it should have been, because they now understand that if you look for it in claims data, it just jumps off the page. It's the largest unmanaged risk that anybody has in a health plan or an account organization. And it's largely, I don't want to say ignored, but it's largely unmanageable because nobody has the ability to engage this population. By the way, we have no magic bullet. We can't engage somebody with dementia, but if you work through the family caregiver who is actually taking their loved one to the doctor, giving them the medications, can have the conversation with a physician, you can have amazing outcomes, right? So we've built a care model around enabling the family caregiver. And then we have some technology and other things that sort of make that happen. But the basic approach is you simply sort of think about this is a population that is not engageable in traditional programs. But if you have a caregiver centric approach, you can engage them through their family caregiver and you can get really good results.